I'd like to take the opportunity to discuss some of the issues behind weight loss surgery. It's fair to say that you're not going to be able to get all the information from just one source, but I'd like this talk to be a useful thing for people thinking about weight loss surgery or people with friends or family thinking about weight loss surgery. It's common knowledge that obesity has become a big problem in Australia and the rest of the Western world. You only have to open the papers and every single week there's a different article about obesity and what an unsolved issue it is. If you look at what's happening in Australian society, you'll see that more and more people are heading towards this area, whereas in 20 or 30 years ago the majority of people were this normal body weight. Body weight individuals in Australia are now in the minority, and most people are either overweight or obese or severely obese. This has a lot of implications. Not only are people who are overweight and obese uncomfortable, they also are at increased risks of diseases and disorders which can shorten their life. The average person with a BMI of 35, that's equivalent to about 20 kilograms overweight for most people, has a yearly risk of death of common conditions like heart attack, stroke and cancer, which is twice that of the normal weight individual. So somebody who spends 20 or 30 years with a weight problem becomes increasingly unwell as time goes on. Obviously having surgery is a radical step. So why do people consider surgery and why is it becoming increasingly common? It's obvious to say nobody wants to be overweight, and this is a perception that is often missed out in the general community in discussions about obesity. Obesity is not a choice that people take on voluntarily. It's something that occurs to them or is thrust upon them. Most people who come to surgery do it when they feel they have no other choice, and most people have tried everything else before they consider it. When you speak to people considering surgery, you'll find there's usually a trigger that leads to surgery being considered. For some people it's a medical condition that has been diagnosed, it's a concern that they won't be around to look after their kids, or very often nowadays it's because they know somebody who's had weight loss surgery and has done very well. From our point of view, medical reasons for obesity surgery are very important, but when I speak to people it's obvious that most people are primarily interested in escaping the physical, social and mental disabilities that their weight puts upon them, and they're sick of the constant battle with diets. It's very easy to document the medical benefits of weight loss, and most of the trials of weight loss surgery show similar things, that significant and severe weight-related problems disappear quite early with surgery, and over 50% of these disorders will disappear completely. So how do we gain weight and how do we lose weight? You have to go back to basics. Becoming overweight is a result of a chronic energy imbalance, which means that people have been in the habit of eating more food or calories than what their bodies have been burning up. It doesn't matter whether you think you eat a lot of food or don't think you eat a lot of food. If you're gaining weight, it's because you're eating more food than what you need. And the only way you can lose weight is by using a lot more energy than what you're eating, so your body will use your energy stores. Fat is simply energy stores. So people who are overweight are like an ever-ready battery waiting to be pulled out of the mains. So there are obviously a lot of different things you can use to help you lose weight. Diets and exercise and drugs are very effective in treating some individuals, but when you use these things to treat groups of individuals, what you find is that on average the results are very poor. If you put 100 people on a diet, you might find 5 or 6 will lose a lot of weight, but the average weight loss in the group as a whole will only be 3, 4, 5 kilograms. And if you look at the people 2 or 3 years after they've started the diet, the majority of them are heavier than when they started. The one primary difference between a sustained diet, a 2 or 3 year long exercise program, and drugs and other treatments compared with surgery is that on average, people who have had weight loss surgery lose a large amount of weight and they keep it off. Many patients achieve their weight loss goals and get very close to their desired weight. Some patients don't do as well, but on average, the weight loss results are about 5 to 10 times greater than what you get with a diet. It's important to realise that surgery works the same way as other weight loss treatments. It works by getting you to eat less food. The reason why it's more successful is related to the strength of the procedures versus a diet. So why would somebody at a certain stage of their life decide to have surgery? When you speak to somebody who's had a weight loss operation, they'll tell you themselves. They have better health, they have more energy, they have better self-esteem, they're more social, they buy better clothes, they're more outgoing, they have more confidence in themselves. They've found that they've succeeded with the weight loss because of the operation, and although most of them have had to pay some money in order to have the procedure done, they save a lot of money. Simply eating less food saves money, pays for the price of the operation within a year or two, and for people on medications, reducing or stopping the medications is also very cost effective. Having weight loss surgery is not like having a hernia fixed up or a lump removed. So it's not at all like other forms of surgery. Surgery is a component of the package of care, and if you rely on the surgery to do all of the work, the majority of people will fail. You need to combine good surgery or an operation that suits you with the right mental attitude and a lot of organisation and planning to get your portion control of your eating right. It really is quite different from any other sort of surgery that we do for any other condition. And with this operation, we form a partnership with you in order to treat your problems. I'll be talking about the operations a bit later on, but I'd like to introduce the concept that they all work the same way. The goal of the surgery is to change the anatomy and the function of your stomach, and this slows down your eating and it takes away your hunger for large proportions of the day. Many people won't feel hungry for months after their operations. You then need to be trained to eat the right way so you don't defeat your operation. It may have taken you all of your life to get your weight problem as severe as it is now. You cannot expect that you'll be able to train yourself overnight to eat a new, appropriate way to keep your weight off. And the most important thing for the surgery is that you have an ongoing commitment, otherwise you'll get short-term success but become a long-term failure. And most people have invested too much in the surgery to want to do that. You need to be able to look at and change the way you eat. And that means changing your approach to food at dinner times at home and in social occasions. We have a reasonably large team and we're able to give you advice about what you can do to help manage this. Simply enough, for all of the operations, there's 3 steps that you need to focus on during the day, and these 3 things are the key to the procedure working in the long term. You have to, in order to reduce the amount of food that you eat, you need to reduce your meal portions, and that's obvious. And we use special tools such as specialist plates to help you get used to this concept. You have to reduce the frequency of the meals that you have. Most of us put too much on our plate. The more times we eat, the more times we expose ourselves to eating too many calories. We also have to change the type of food that we eat, so we eat more reduced calorie foods rather than high calorie foods. The sort of things that our mothers or grandmothers would have fed us are more appropriate than the pre-packaged, refrigerated or takeaway foods that a lot of us eat. Part of the training that goes with having surgery is discussion about all of these topics. We can't take you out of the equation, and everybody is different, and we're all attracted to foods for different reasons. We all eat for different reasons, but common things are we eat because we like food. We eat because food's an important social event. We eat because Eating helps us when we're happy or sad, and we eat because it fits our lifestyle. All of these things need to be changed so that you're able to go about your life with a new type of normal eating pattern, one that doesn't expose you to more weight in the future. As I've said before, this is a partnership. The team involved is a large team. It involves your surgeon, your weight loss doctors, a nurse, dietitian, psychologist. But you bring a lot to the table as well, and that you will have people who support you, and they should know about your decision, and they can help you if they're given the right information too. Friends and colleagues can also help. There will be people who take comfort in seeing you overweight, and they take comfort in seeing you eating. And these are unsupport people, people that will try to get you to eat when you're trying not to. Avoiding these people for a while can help. You can see in this slide that the largest component of the team is you. Because the process of deciding which operation you're going to have and performing the operation is so complex, we like you to have a couple of visits before surgery. The first visit is a get-to-know-you visit where you meet one of our medical doctors, Dr. Regis or Dr. Seeley, and they talk about your medical problems, discuss what's brought you to think about weight loss surgery, and discuss some of the options involved. After this, you'll have some screening tests done to make sure you don't have any medical problems we don't know about and any vitamin deficiencies, and you'll sit down and have a chat with one of the surgeons, either myself or Dr. Kuzenkovas. This discussion can happen once or twice, and the whole point of it is to give you information to make the right decision. After this, you'll be reviewed by our dietitian if you decide to go ahead with surgery. And the long process of aftercare starts soon after going home. We're in touch on the phone within a couple of days, and at 2 weeks, you catch up and see one of our doctors and the dietitian, and we see you every 4 to 6 weeks, or as often as needed for the first year. And I think people should be seen at least twice a year for the next couple of years, and yearly on a lifelong basis. Obesity surgery doesn't cure weight problems. Obesity surgery is just a treatment, and if you stop taking the treatment, the condition can come back. And I think everybody having weight loss surgery should look at it as a lifelong commitment.